The 3 incidences that we have.
In 1988, Ian Clark, who was then a general practitioner from Bengo in Northern Ireland, traveled to Uganda with his young family with the intention of starting a community-based healthcare program.
He came to preach the gospel of Jesus Christ and to help this community to prevent diseases, because it was immediately after the war and the health services were not available in the area.
Kiwoko, a village in the present-day Nakaseke district, was the ideal place for him.
When I came here, when there was really no doctors, just shortly after the war, 88 it must have been, and we started treating patients under a tree. Fresh
from the glitter weather that ravaged the area for 5 years, the people of rural Triangle needed a facility that could guarantee holistic healing. Clark says the hospital started as a TB ward, but is now a private health facility in Greater Luero.
I remember I appealed to start a fund to start a TB ward.
Kiwoko Hospital, as it is, was later renamed and officially opened in September 1991 by the then Vice President of Uganda, Dr. Samson Tseka, as a rural crisis-centered health facility to provide curative and preventive health care to the poor and vulnerable communities.
It's been very difficult to deliver good quality health care services to the rural people here. When you talk about health care, it's not uncommon to look for other places, probably in the urban areas, or even fly abroad to get good health care services. But the people here in Kiwoko, not many of them can afford that.
The facility serves a population of over 1 million people in about 10 districts surrounding Nakaseke. Dr. Peter Serada, the medical director at Kiwoko Hospital, says because they serve a poor and vulnerable community, the cost of some services is subsidized and others free.
But we still find that in general the people in the area cannot afford much. So it is one of the strategies of the hospital to see that we partner to try and subsidize. There is some care which is absolutely free of charge, for example HIV care.
It started small with only 25 grants, but as we talk we are approaching 3,000 in number.
But there's other care which is more subsidized, for example in the neonatal unit, in the maternity unit.
Evelyn Kellen Musime, the Nakaseke District Health Officer, says Kiwoko Hospital has improved in neonatal care in this region.
Kiwoko Hospital has been the only hospital in Greater Luero offering premature health services up to 2018, when it monitored, trained, renovated a structure at Nakaseke Hospital to manage uncomplicated cases of prematures.
The Ministry of Health recognizes Kiwoko Hospital's neonatal intensive care unit as a center of excellence in newborn health. The unit currently admits over 1,200 babies every year with over 90% survival rate. Herbert Kamoga, NTV.